All right, good afternoon. Shall we start now?
Good afternoon, doctor.
Good afternoon, doctor. If you want to start
Okay.
now.
Yes, you will start now. Now, before I'm going to start with counseling and psychotherapy, there are things that I would like to discuss with you. Your examination will be on site. It will be paper-based on May 6, 2021. 10 a.m. As for the classroom, it will be announced later on. So the coverage also I modified. It's just a way that I included pain, personality, and this topic. Okay, that will be for your makeup CA on May 6. You should follow the protocol. As to the quiz, I approve already some students when they presented the copy of their parents' letter. Okay, so because the reason why is it that they were absent is because they were sick or there were some problems along the way. Okay, so moving forward, let's start with our topic on counseling and psychotherapy.
Doctor,
Yeah, can you
I
hear
have a
me?
question. Yesterday,
Yes.
when I asked you about the passing mark is 50%,
Yeah.
50% from the total mark or CA?
Now, basically, the passing mark, as we said, is around 50. No matter what, no, you take that in your quiz. If the quiz is around 10, basically the passing mark is 5. If you're going to have 50 in your CA, basically the passing mark is 25. But along that line, there is a system that the university follows.
Yeah.
So we are going to look into that. So that's the thing. Now the bottom line is, if you have 10, you should get 5.
Yeah,
But
yeah, I got it. Because
in
some
that
students want to know if it's 50 or no, because if they want to do the makeup or not. That's it.
yeah, if no, better you take your makeup. You know why? This will be already a practice of your final examinations. You know, who
Yeah,
knows? Who knows that you will actually get better?
yeah,
So that I encourage you to take, because since you're going to revise also for your final examination, then you might as well take your makeup test. No,
yeah, yeah,
you get it? Maybe you can actually get better, because
yeah. Yes.
in your CA, we're going to get the best. No, the best of what's going to be the scores, your scores. If you do good in your CA2, then that will be carried over, and your CE1 score will be disregarded. Okay, so you should understand that.
Yes.
Yeah.
Uh,
So yeah.
Doctor,
Yes. Yes.
I want
Yes.
to ask you about the special quiz. Did you change? Did you reschedule the date, or it's
No, I discussed with the dean, and basically it will not be online. It will be after the CA. Okay, basically
yeah?
it's after the CA. The CA start around 10 o'clock, and it will be finished 10:55. Then your CA, your quiz will be 11 o'clock.
Oh,
Okay,
okay.
so
Um, it's also on 6th of May, right?
it's also on 6th of May.
Yeah. Okay.
The
Thank you.
coverage is sent to you. Okay, so
Okay.
you just come here only once, no, because we do
Mhm.
not want COVID-19 to be spreading just in case, no.
Mhm.
We would like to protect you also, so you come only once during that time, and the
Yeah.
coverage is the same also, because
Mhm.
one of the coverage will be included in the quiz. So
Yes.
that's the main point of that. So it will be easier for you.
Mhm. Thank you.
Okay, so far I got 6 students already. I approve already 6 students, since their parents wrote an email. You wrote a mail, signed, so
Yes.
they are informed anyway. So please do so. Please revise and prepare for your exams.
So we will also
Nevertheless,
have
yeah.
personality, pain, and counseling, right? In the quiz.
Uh,
What are
the
the
quiz is
stages?
only one, personality only.
Oh, okay.
And for your CA, pain, personality, and counseling.
Oh,
Okay.
okay. Thank you.
So right, moving forward. Any other questions? Okay, no more question. Let's proceed with counseling and psychotherapy. Um, basically every human being, every person is doing this, but they are not doing this scientifically. If you have a problem, the natural tendency is that you're going to see a person. You tell your problem. So either that person will listen or will give you so many advices. No, that's counseling in any way, but it's unscientific because sometimes when you get an advice from your friend, it will create more confusion rather than solution to the problem. Now, the main point in counseling is that the counselor is trained to do only one thing. And what's that? To listen. So this is the dictum of counseling. You open your ears, you close your mouth. You do not say anything. Now, the moment that a counselor will say an advice, they are not counseling anymore. They are already advising. So this is actually very different because we are supposed to be listening. And, listening is a difficult thing to do because sometimes at the back of your mind, when a friend comes to you and tell their problem, you have already an immediate solution. You think that as a person who is listening, you have already a solution. You can already help your friend to solve their problems. So we are going to redirect our attention into how we should be utilizing the scientific knowledge on counseling in helping other people. Remember this, you're going to become health professionals. You're going to become dentists. So part of your job is to educate and to counsel your patient. Especially, they need to come to you every 6 months. They need to come to you very often. They need to practice so many dental practices, no, that will help them in order to have this very good dental health. So in any way, how are you going to implement that? How are you going to let them do that? How are you going to let your patients do that? So as I mentioned to you, in counseling, we are going to train somebody who needs to listen or who can listen and who talks less. And at the same time, we are mirroring in behalf of the patient because at the end of the day, we would like that our patient to solve their own problems. The patient comes to you, any person comes to you because we would like someone to solve their own problem. We don't give solution, but we listen, we mirror. That's one major concept that we can derive from counseling and psychotherapy. And of course, when we say counseling, we listen, don't talk too much. In psychotherapy, the psychotherapist will just utilize so many psychological principles, laws, and knowledge in order to help the patient. In that case, the person who listens, the persons who practices psychotherapy will be helpful and will be therapeutically, let's say, effective to the patient as such. So let us try to start with the definition of what counseling is. Now, basically, counseling refers to a wide selection of services and activities that counselors choose to help people, take note of this, prevent disabling event. Now, always take note. A person comes to another person because they have a purported problem, because this problem seems to be hindering them. These problems affect their functionality. Remember this, no? If you are anxious, if you're afraid, chances are you cannot eat, you cannot do your assignment, you cannot work, you cannot do anything. In short, your functionality is affected. In short, you need someone to listen to you, but hoping that you can find a solution of what bothers you. Now, for human beings, the most difficult thing that we will actually solve will be small problems that would always hinder our functionality. This is always in connection with our emotional problems as a whole, no? So like disabling events, maybe you have seen your marks, you have failed in one subject. This is the thing that bothers you. Maybe tomorrow also, you're going to take another exam. That is another thing that disables you. You cannot eat, you cannot think. So you need someone to listen to you so that you can actually do all the things that you usually do. Now, another thing that we have to look into will be on the overall development and remedy of existing concerns. Now, don't be mistaken when you say you're going to find a remedy. The remedy and the solution of the existing concern must always be suggested by the patient or by the person, not you. You are just there to listen and, of course, to navigate with the patient on what they need to do, what they are supposed to do. Sometimes a counselor for 1 hour may not open their mouth, will just actually gesture like nodding, then their hands also, and so on. Or maybe if they will say something, they'll just say, go on, tell me more. You see, these are some of the words that we can actually use in order to encourage the patient to tell more, so that as they tell, they are already solving their problems. You see, as you are going to tell your problems to someone who is willing to listen, at the back of your mind, you are trying to find a solution already. So in that case, the thing or event that hinders your functionality is actually solved. It will be solved by the patient, but not by the counselor. The only thing that the counselors do would always be to listen and let the patient solve the disabling events that transpired or that happened to the patient. Moving forward, okay, so let's see, professional counseling, on the other hand, is the process of establishing relationship. Now, counseling and professional counseling may not take place on one day only. But of course, you can actually go to anybody, to any person whom you trust. That means to say that trust is already established. But if the problem is so intense and you really would like to see a professional that you have never seen, then you have to undergo a process. You have to come out with a relationship. You have to enter into a therapeutic relationship. We call that as therapeutic relationship or therapeutic alliance with somebody who is willing to help you. But of course, the most obvious thing that we can actually do at first will be to go to the friend, to go to our friends. Yeah, we trust them. But if you go to a stranger, a professional, but you do not know them, then basically you need to establish your trust. You know why you have to establish your trust? Because as you talk with that professional, you are going to open up. You are going to provide so many details about yourselves. You're going to provide or tell about the problems that bother you that seem to be very personal. You can tell anything that you want. And the only thing that the professional counselor will be to listen. They will not judge you. They will just listen. So that's the job. So you are going to establish therapeutic relationship, counseling relationship. That means to say the session may not happen only once. It will be happening in a series of meetings. Okay? So you have to establish a relationship in order to identify the needs. That is the first thing that we do. Now, as a counselor, the first thing that you are going to look into will be, of course, to know your patient also. Then after that, you have to look into the concerns of the patient. You have to look into the needs of the patient. Then you are going to help the patient design strategies in order to satisfy these needs and actively assess your patient to carry out the plans in order to them make decision. You know, the moment there is disabling events that actually hinder your functionality for that day, you cannot even make a very thorough decision. Small decision or big decision, they're alike. You cannot make decisions at all. That's the reason why your functionality is truly affected in this case. So you need to find a solution. You need to solve the problems. You need to develop self-awareness. And of course, after that session with the professional counselor, you can already live healthier. The anxiety will be solved, or maybe listened, or will be eliminated, or the fear will be solved, the fear will be eliminated. Now, you cannot just actually do that or eliminate that in a single meeting. It will be a relationship that you need to establish 3 or 4 meetings. With my experience as a counselor, I usually need 2 to 3 days in order to establish the trust. Because you see, the moment that a person comes to you, they will not actually tell everything about their lives. They will not take about the deeper secret or deepest secret. The same way when you're going to talk to your patients, no? Patients is just enough that they're going to tell their names, their age maybe, and a little bit of their history. In similar way, in counseling, it's just enough for the first meeting. Sometimes they do not talk. Sometimes they don't open their mouth. So you are there for 1 hour only, but the only thing that the patient actually tells you is the name. Sometimes it's very frustrating. But of course, you will just be there. Stay with the patient, then listen to the patient the moment they're actually going to open. Just be patient, no? The moment that the patient opens their mouth, you are there to listen. That's the big thing that you need to do. Okay, do not be bothered. The patient doesn't talk for 1 hour. It's okay. You just be there. You just also sit down with the patient. That is happening on the first day, maybe. Second day, it may transpire. But more or less, the patient will actually start opening their mouth on the second day. But don't expect that the patient will tell everything. See? Until such time that the patient will trust you. Now, as a duty for the professional counselor is that you need to promise that you are not going to divulge to the public anything, whatever the patient will actually tell you, will actually reveal to you. Do not do that. Police case, if they're going to tell you that they killed someone, it's not your duty to reveal that to anyone, because there is a promise, there is a bond that binds the counselor and the patient. No, this is our professional ethics. You do not divulge someone. The moment the patient can tell anything to you, then that will be the time that you can actually become effective. You have to prove that. No. So, patient, even your friends may not tell everything about you, about themselves. So you experience that nevertheless. In counseling, that's very similar. It's very difficult at first, but in the end, the patient will reveal everything. No, and that will be very satisfying on the part of the counselor also, because you see the patient trusts you. The patient even trust everything against themselves, give to you all the negative things that they have in mind, that they have done. As long as you promise, you see the feeling that the patient actually trusted you once, that's a very good thing. Now, moving forward, counselors comprise relationship in which school counselors or student development specialists confer with parents. We have to talk with parents. We have to talk with teachers and other professionals in order to identify the student needs, your needs, and also to select appropriate services. There are so many roles. We are not just actually here to solve the problem of the patient. We are also here to guide the patient or somebody in order to make a very strong or very good decision, a very futuristic decision, like in the case of deciding what type of profession you're going to proceed or you're going to pursue when you go to college. Now, that's why the most important job of counselor in the university, in the school, is to guide the students in order to select a very good course for them. Yeah, they have to match the capacity of the student with the type of profession that they really would like to choose. So we are here also to advise, to guide the patient in order to make a very good career decisions as such. So we work with everyone, parents, individual, groups, organizations. So working in organization will be easier because we generalize. Working with an individual will be a little bit challenging because we need to gain the trust of that individual. Yeah. So if you're a counselor, you should understand different principles that you need to apply. Always take note of this. If you are a counselor, you are not God. You are not somebody that is above your counseling. Remember always that you are going to adopt specific principles, that you are just actually there side by side with your patient, trying to find a way to solve the problems that they may actually have. So as a counselor, you are there because you know something, because you are there because you can actually help somebody. You are there because you were taught beforehand the different principles that you would be using in order to help your patient. Like in the case of the next slide, let us try to look into the development of counseling. How is it that counseling is a very important part of psychology? You see, after understanding the personality, the basic thing that a psychologist will actually do is to learn how to counsel. You see, if you know the personality of someone, you will be able to help that particular person already. Now, the basic thing that we understood in personality would always be the different developmental needs, developmental tasks, the different stages of the development, so that we'll be able to identify. Just like in the case of person who comes to you, let's say a person comes to you at the age, let's say he's 19 or she's 20. More or less, as a psychologist and as a counselor, you will be able to know what type of patients are seeing you. You see? So you will be able to frame up on how you're going to deal with them. You will be able to plan on how you're going to deal with them. Just like in the case of talking to someone, maybe you will be adopting the principles that would be suggested, or that was suggested by Carl Roger. You see that in the picture. So let us try to look into the influence of Carl Roger in counseling. He really is a very good humanist. One of the humanistic psychology who founded humanism. We have also in that case Abraham Maslow. No, so let us try to look into that one. No, so he emphasized a group-oriented counseling relationship as opposed to an informational and problem-solving one. You see, so he really tries to get away with informational and problem-solving one. He tries to look into a relationship. So you have to establish a longer relationship with the patient. So you have to influence the counselor, and the counselee must influence one another. So that's the, because you have something in common. You see? So this is actually his idea. So the incongruent and the congruent selves. Now, on the first side, the left side, the incongruent, see the self-image and the ideal self. So we are going to look into that. He emphasized about this, no? The self-image, the image that the patient has, and his ideal self. Sometimes there is actually a conflicting idea between the self-image and the ideal self. You see, there is a disconnect between the two, especially if you're going to look yourselves right now as if you are not good at all. So you look down. Your self-esteem is decreased. It's very low. So you have a very low regard about yourself. So that's the reason why you develop inferiority. And of course, here comes the ideal self. You should be this. You look at yourself here, very low, and you are thinking about yourselves to be very high. So there is a disconnect. See? So the ideal self and self-image are disconnected in this case, because the self-image is very different to the ideal self. No, there is only one little overlap. Now here, self-actualization will actually be very difficult. The one that overlaps is the one that actually sometimes will influence you on how to behave. Now on congruent self, the overlapping part will be a little bit larger, no? So in that case, even though there is a disconnect between a little bit of your self-image and ideal self, somehow you can work it out. because you can always look into the achievement of your ideal self in the end. It's just that you do not look yourselves lowly, but somehow you are there. You are actually getting there. So on this part, the overlapping part will actually be the one that will actually help you. No, there is more overlap, then you can actually self-actualize. You can always connect your self-image, the image that you have right now, with the ideal image, the ideal self that you really would like to become. It's very difficult actually to have a congruence between self-image and ideal self. There will always be a disconnect. But if we're going to look into a very narrow congruence, then there will be a big problem. But if there will be a very big congruence, then chances are you can easily help the patient. Chances are the patient may actually self-actualize. So this is basically what Carl Rogers was trying to emphasize. Now, as a counselor, you have to look at that way. You have to find that congruence between or in your patient. You have to identify the problems that they have and what are the things that they are actually looking into in the future. This is what we need to do. All right. But of course, there are so many influences in the development of counseling psychology. No? So, like in the case of behavioral approach, no, you could remember that the behavioral approach comes from the suggestion of John Watson. Remember the four schools of thought in psychology? We have John Watson first, no? Behaviorism. Now, here, so many theorists and so many counseling techniques and psychotherapeutic procedures or processes that were proposed. In the case of implosive therapy by Stample in 1961, no, this is actually very helpful, especially in terms of some sort of anxiety disorder. We have also systematic desensitization by Wolf in 1958. This is a very good way of helping the problem who undergoes phobia, who encounters phobias. There are so many forms of phobias, and these are all under anxiety-related disorders. No, we have also Albert Ellis, in that case, rational emotive behavioral therapy, or we call it REBT in 1962. REBT is under cognitive and semantic theories. Now, so basically, you need to connect your reason and your emotion. Now, I keep on telling my students that the most difficult thing that you can actually encounter will be emotional problem. Sometimes reason cannot win against emotion. So there will always be a connection between rational and at the same time emotional. So it must always be balanced. That is basically the idea of Albert Ellis when he mentioned and when he formulated his theory on rational emotive behavioral therapy. We call that as REBT in 1962. There is also another one which we call ego psychology by Stiprel and Grant in 1972. A lot of you may be familiar with what ego means. Ego means the current here and now. If you can recall the structures of personality of Sigmund Freud, no? Id, ego, and superego. The id represents your animalistic desire that's oriented to pleasure. Your superego is oriented to conscience. And your ego is oriented to here and now. That is your reality. The part of your personality that operates on the here and now, operates on the present. Now, if you are going to look into ego psychology, there are so many things that comes here. Egoistic, egocentric, egotistic, among others. No? The most important thing is that you need to find out who you are and what you are. Then number 5, we have humanistic and existential psychology. Humanistic psychology is one of the big movements that revolutionized psychology. And of course, the existential psychology, no, A lot of psychologists join and philosophers join existential psychology. We have the like of Viktor Frankl, we have the like of Rollume. In the case of humanistic psychology, we have the like of Abraham Maslow, we have the like of Carl Rogers in that case. No, this is a movement. No, all right. So we have Combs, we have Girard in 1964, we have Rollume in 1966, we have Abraham Maslow in 1957. At the same time, there is the advent of group counseling. So in that case, group counseling, the most famous group counseling that we can actually do, and that will be very helpful, will be family counseling. And of course, there are others in the case of Alcoholic Anonymous, among others, where we are always engaged with the group rather than an individual. But of course, in the group, sometimes the group actually needs to follow protocol. The group needs to trust one another. Just like an individual counseling wherein the counselor trusts the counselee and the counselor trusts the counselor. In group, also especially in group of 7, sometimes it will be very difficult to establish trust in that particular case. But as you group together, you grow together, you work together trying to find a solution of anything that bothers you, you will learn how to trust one another. That is actually the main point in this case. Moving forward, we have also new theories like in the case of psychoanalytic, including psychodynamic. This is focused on psychoanalysis and focus on the work of Sigmund Freud. We have person-centered. We have focused on the work of Carl Rogers. We have cognitive. We have also behavioral, and we have also affective. Sometimes some psychologists would combine 2 or 3. Now, you see, these new theories are actually here to help us. We should know. An advisor may not know, but a psychologist must at least know some of this so that they will be able to utilize the different principles that they learn in understanding these different theories in their practice as counselor. Like if you're going to be a dentist, there are so many things that you're going to utilize in your practice, but you will not know everything about dentistry. At least you will be able to use the knowledge that you know about dentistry in order to help the patients as such. We have to admit that, no? We do not know everything. I'm a psychologist, but I do not know everything about psychology because there are things that are left to study. There are things that are left for research, and we have to know that. That's why controversy and after controversy is haunting psychology now. There are so many things that are actually coming that we do not understand. You see? Like in the case of the psychology of COVID-19, there are things that we cannot understand. It will be very difficult to understand. No? Among others, we have some concepts that we have in psychotherapy. No? Now, in psychotherapy, we will be able to utilize the different principles that we know in psychology in order to be therapeutic, in order to be very helpful to our patients. Somehow, we are the concept of Sigmund Freud is very influential in this case. So we have psychoanalytic, and we have also so many things. We have also family therapy. We have also experiential therapy. We have also Adlerian therapy. And in the case of Albert Ellis, we have also RABT. No, these are some of the psychotherapy that we'll be able to use. All concepts have been based on specific principles designed by specific psychologists. Now, in the case of family therapy, this is an extension of group counseling. No, that is we have to involve all the members of the family. Although it is going to be very easy, as it is said, when the family members are cooperative, but it will be very difficult to gather family members as such. Now, with my experience as a counselor, often teenagers would always have some conflicts with the parents. That's why in family therapy, it's very imperative that we are inviting parents and at the same time siblings. The dynamics of the family needs to be understood by the counselor, needs to be understood by the parents, understood by the family psychotherapists in order to solve or help coming up with a solution of things that would have concerned him. Right? So another one, of course, is the functional emotive existential therapy. This is the one that I actually invented. No, my doctorate is actually focused on that. No? Somewhat, if you have some problems, definitely your functionality is affected. And why is it so? Because there could be some problem with your emotions, and there could be some problem with the meaning of your lives. So in that case, you will not be able to find your meaning. In Japan, there is something that's actually going on right now, ikigai, the thing that actually makes you live, the thing that will actually makes you survive is the ikigai. It's the meaning to live. So that's exactly my main point here. So we really would like to help an individual trying to find the meaning of their life so that as they know it, as they will try to know it, they will be able to, overcome whatever problems that they may actually have. Another one, of course, that appears third time is person-centered therapy. This is coming from the work of Carl Rogers. We have to look into the totality of a person. We have to find out the ideal self of the person in the ideal self and the look or the self-concept that the patient may actually have. Now, so that's the thing. Now we have also behavioral therapy. Now the basic thing that we need to understand in behavioral therapy is that we need to find out, we need to help the patient modify an acceptable behavior. How they're going to do that? They have to learn the norms of the society, the culture of the society they're living in, then they need eventually to find out how they can change. Now, on the other hand, cognitive therapy is a therapy that will help us focus more on understanding or changing the way we think. Now, you see, basically, the major cause of our problem that we have right now would always be associated with the way we think. You see, the moment we will be able to find a way to modify the way we think, then we will be very helpful. This is basically how and what psychotherapists will actually do, help the patient change the way they think. As I mentioned to you earlier in our discussion when we tackled about sensation and perception, you see, particularly when they discuss about principles, you're familiar with that, no? We try to make sense on the totality of one thing. Other people are just focused on one problem and one problem alone, and all throughout their life, they're going to be focused on that. So even though that particular problem that they may have will be tiny and will be very little, it bothers them. See? So we change the way we think. That little thing that bothers us will not bother us anymore. So there is a sudden shift on how and what we think. It's easier said than done. That's the reason why when we conduct psychotherapy and counseling sessions, it needs to be a relationship, no? So that we can actually see the progress of an individual, no? Then we have existential psychotherapy. This is the most famous psychotherapy that we are actually having right now, no? The finding a why to live, a will to live, the meaning to live. And we have also Stout, as I was actually telling you a while ago. We have to look into larger perspective rather than the smaller perspective. See? And of course, multimodal therapies that we need to combine a combination of all these types of therapy. So the basic thing that we need to understand here is that we try to be very helpful to our patients. We try to be very helpful with our colleagues, just in case, with our counseling. So as a counselor, you should understand the basic principle of psychology, the basic principle of psychotherapy, the basic principle of counseling. See? Just like dentistry, your dentistry will be very easy, Just pull your tooth out at dentistry already. But it's easier said than done because there is a technique. When you're going to pull the teeth or the tooth of a person, you have to understand oral biology, you have to understand infection, you have to understand pain, you have to understand the psychology of an individual, among others. There are so many things that you are actually trying to apply in order to pull that tooth out from your patient, among others. You see? So the same way when we counsel, the same way when we conduct psychotherapy, we have to do that. Now, so let's try to move forward. Okay. Your essential services in counseling. Now, in here, counselors have tried to distinguish counseling process from other therapeutic relationships such as psychotherapy, but these distinctions are not very clear because we have something in common. We have to create a professional relationship. We need to establish a professional relationship with our patient. There is counseling when there is a relationship between counselor and the counselor, just like that. But of course, counseling is differentiated from consulting. As I mentioned to you, consulting is just advising. Consulting is specifically going to be focused in one problem, one solution alone. And sometimes the problem can always be solved by the consultants. That is the case, no? So it's not counseling because you are not just actually leading the patient. Here you are just directing the patient in what you're going to do. Although consulting is a kind of relationship, this is also a professional relationship in which two or more people will identify a purpose. Identify a purpose, establish a goal, both ways mutual, plan strategy to meet the goal and assign responsibilities to carry out strategies. Now you have to plan to meet. This is the main difference between consulting and counseling. In counseling, you can actually help the patient plan strategy. Help the patient plan strategy. Here, together, you and the consultant will plan strategy. In counseling, help the patient plan a strategy. There is the main difference between the two. In short, in consulting, you have a direct role. In counseling, always your roles will always be indirect because you're always keeping in mind that it's only the patient who solves the problem. In consulting, both of you will solve the problem at hand. And sometimes the consultant will always play a vital role in the solution of the problem. Now, the consulting relationship is always informational, not unlike your counseling. Okay? And of course, we have here consultations. Okay, so let us try to find out the distinction between counseling and psychotherapy. No, Webster's New International Dictionary defined counseling as a practice or professional service designed to guide an individual to a better understanding of problems and potentialities by utilizing modern psychological principles and methods. Now, we need to understand the different principles and different approaches of counseling. Now, moving forward, let's try to look into the different goals of counseling. So, when we enter into a counseling relationship, both ways, the counselee and the counselor must always come in this mind. No, always. No, they have to facilitate changes in one's behavior. Just like a dentist, when a patient comes, the patient pays a professional fee. So there is one thing. No, here they just consult. You do something, they pay you, and you have to do something. In counseling, it's different. Now, one will facilitate changes in one's behavior. So there must always be, at the end of the day, at the end of the relationship, there will always be a change in behavior. On whose part? On the part of the counseling. Another one is that counseling is aimed towards the improvement, both ways, both on social and personal relationship of the counselee or of the client. The reason why they come to you, the client, I mean, is that there is already a problem. They cannot go out, they cannot face other people. And sometimes they have a very low concept, the way they look at themselves is very, very low, losing their self-esteem. So it will be very difficult for them to do self-actualization. Now, another goal is increase social effectiveness and one's ability to cope. The moment you will be able to find out your real purpose, the moment that you have changed your behavior, you will be able to come out from a shell, you will be able to live with your community, you are going to contribute in your community. Another goal is that counseling learn how to make decisions. Who will make decisions? It will not be the counselor, it will be the counseling. The only reason why you are there is that you need to lead the counseling to come out with the best decision that they could have in order to solve their own problems that they may actually have that bothers them. Okay? And of course, another goal is that counseling will enhance the potential and self-development. See? It will actually help the patient. But a lot of counselors enjoy counseling because they themselves are benefiting from this. They enjoy, no, counseling other people because they learn also about themselves. Both ways, like in teaching, no? In teaching, when we teach, we also learn. The teachers learn. Students learn, teachers learn. In counselor-counseling relationship, counseling learns, the counselors learn. In dentist and patient relationship, the dentist learn and the patient learns also. So in both ways, mutual benefits can actually be observed. Now, these are the stages that you need to undergo in order to enter into a counseling relationship. Always take note, you do not just actually go to the counselor and tell your problem. You do not just actually go there, hey, here I am, I want to tell you my problem. Please help me solve my problem. You cannot do that. Because don't expect that your patient will always do that, will always be there, open. So, an open book. Expect that when a patient comes to you, they have secrets. They do not want to tell everything because the moment they're going to do that, they lose out of control. They cannot control information that's actually flowing out from their system. So they are not empowered anymore. So that's the thing, no? Sometimes they do not trust you. Pure and simple. Okay? So number one, you have to establish a relationship. As I mentioned to you, counseling is a relationship that needs to be established. Right? So your respect is going to be a very playing a very crucial role in establishing a relationship. You respect, no? The respect your patient. You show respect to your patient. You show genuineness to your patient. A genuineness to help. No? This is what we call as congruence. It will allow the counselor to be who they are without playing a role or hiding behind a facade. You are just actually going to be very truthful about who you are and what you are and what you can actually do. Do not just present yourself as if you are a Superman who can actually solve anybody's problem. You cannot actually do that. You have to be very genuine and you have to be very, very respectful and congruent and realistic on what you're going to tell your patients. Right? Number two is you explore consent. The moment you establish your relationship, here comes already the time when the patient will tell everything. You see? It will actually be there after 3 or more meetings, no? You try to explore concerns already. That means you focus on concerns, either developmental or problem-oriented, in order to make decisions, in order to remedy that situations, acquire new skills, or enhance self-awareness. No, the exploration phase is characterized by number one, construct language, techniques, and strategies created and endorsed by particular approaches selected by the counselor. You enhance the capacity of the patient to decide by themselves. So therefore, it is imperative for the counselor to know something, to know the principles of counseling techniques and psychotherapeutic techniques in order to be effective and to be very helpful to the patients. All right, moving forward, you take actions. After exploring, you see, establish your relationship, explore, then you take action. What are you going to do? Okay, What will the patient do? Taking action is influenced by theoretical beliefs and helping models that's embraced by the practicing counselor. So let the patient do. No? Here, psychodynamic approaches feature the development of insight. You expect that insight will be there. You expect that there will be reorientation. You expect that there will be the change of thinking, the way the patient thinks. You are expecting that the patient redefines their goals. Or maybe the patient will be able to choose alternative behaviors that they may actually, you see, they may actually observe among themselves. Then lastly, we have the final stage. This is what we call as closure or termination stage. Now, both counselors and counseling arrive at a point in order to cut a relationship. Now, remember this. In order to come out with this stage 4, you need to initiate that in number 1, okay? That is establishing trust, establishing a relationship. So you are going to make a time frame. Maybe at the beginning, you're going to say, I'm going to meet you only once a month for a period of 6 meetings, 6 weeks. So there is already a time frame. Now, in the end, it will not be very difficult for you to cut the connection and relationship between you and your patient. Always the professional relationship will be there. But the problem is, patient may come to you, counseling may come to you because they are broken. And they will find completeness with you. Therefore, they own you. That's the reason why the most difficult thing to do is number 1 and number 4, wherein you need to terminate already your relationship with the patient. Now, both counselor and counselee arrive at a point where the purpose and goals of the relationship have been successfully achieved. And now it's the time to move on and to do other goals and other relationships. In 1996, Gladden claims that this is the most neglected of all stages. You know why neglected? Often, this is the most difficult and most neglected because the moment the patient actually thinks that they solve their own problem, they do not go anymore to the counselor. They cut. Instead of there should be 6 meetings, they attended only 3 or 4 meetings. On the 5th and 6th meeting, they do not do it anymore, just like what we do when we take medication. Supposed to be that the antibiotic prescribed to us would be for 7 days. But since we are already well, at the end of third day, we stop taking already antibiotics. So no wonder Glading mentioned about this, that this is the most neglected part, but chances are sometimes we don't usually do this, no? Because on the patient side, the patient refuses to come. Remember, when you're going to establish a relationship, there is money involved because sometimes you agree that there is a relationship, then you have to pay. That's the thing. All right. Most counselors in clinic settings embrace a combination of all this. We call that as eclectic philosophy, where you utilize different techniques, different knowledge in order to be very helpful to your patients. Now, eclectic counseling is the integration of a number of related theories. You will not be necessarily be a follower of Sigmund Freud or Carl Jung or Erik Erikson. You can integrate all these concepts, all this knowledge, so that you will be very effective to your patients. No? So that is actually the end of our counseling and psychotherapy in this case. Now, always take note of this. In order to become a very effective counselor, you should know how to listen. That is the only job that they will actually do. Open your ears and close your mouth. Then if you have that, you can become an effective counselor already. Okay? Any questions so far? You're still there?
Thank you, Doctor.
Yes, okay.
Yeah, we're still here, doctor.
Very good. Next meeting, we're going to start with abnormal psychology. Abnormal psychology will be included in your final examinations, okay? So with that, I think we're good to go. For your attendance, please write your ID number on the message board before I'm going to turn this off. Okay? Thank you so much and have a good day.
Thank you, doctor.
Bye-bye. Thank you so much.